Hi, this is Divya Prakash from nuclearmedicinesolutions.in. In the current series, we are discussing about NABH accreditation of hospitals and diagnostic centers. And this is the second part. We are going to discuss about accrediting organizations and their standards. This video series had of 4 videos, in which the first part we discuss about what is quality in healthcare, and this is the second part. In the third part, we are going to discuss about structural, procedural and outcome related needs of accrediting organizations. And in the last part, we will be discussing about how to set up quality indicators. In the first part, as I said, we discuss about what is quality in healthcare. We discuss the building blocks, we discuss their needs and what are the benefits of accreditations. So let's begin, where we will be discussing about accreditations, organizations and their standards. This video is going to set stage for the next 2 videos. Here we will be knowing about what are accreditation organizations and what they actually set the standards. So based on those standards, we will be going ahead for the structural needs, procedural needs and outcome related needs. So the healthcare organizations, they get accredited with some accrediting body, but those bodies itself are accredited by an organization that is called International Society for Quality in Healthcare. This is an umbrella organization responsible for accreditation bodies. It was established in 1985 at Dublin, Ireland. It's a non-profit organization and community, and dedicated to promoting quality improvement in healthcare. It spans over 70 countries and 6 continents. This is the list of international healthcare accreditation organizations. Most of the major countries have their own accreditation bodies, like in Australia, Canada, France, Europe, Egypt, India. India has a NABH, that is National Accreditation Board for Hospitals and Healthcare Providers. In Malaysia, Netherlands, New Zealand, Saudi Arabia, United Kingdom, United States has got a number of accreditation bodies. Turkey. This United States has JCI, that is a Joint Commission International. This accredits healthcare organizations from across the world. So in India, as I said, JCI, they give accreditations. There is a NABH, that is a National Accreditation Board for Hospitals and Healthcare Providers, and there is an ISO certification is also there for healthcare organizations. So let's see what is JCI. JCI is Joint Commission International. It is a non-profit organization based at Chicago, United States. It accredits healthcare organizations and programs. The international branch of this accredits medical services from across the world, and it itself is accredited by ISQA, and it is a prerequisite for international Medicaids or medical reimbursements. So those hospitals whose clientele base is international patients, so they need to undergo this JCI accreditations. JCI was set up in 1951 with the name of Joint Commission of Accreditation of Hospitals, that is JCAH. In 1987, this name was changed to JACO, that is Joint Commission of Accreditation of Healthcare Organizations. In 1998, JCI, that is Joint Commission International, was established as a division of Joint Commission Resources Inc. In 2007, the name was simplified as the Joint Commission, and it was rebranded. Name, logo, tagline, everything was changed. So let's see what is NABH, National Accreditation for Hospitals and Healthcare Providers. It was established in 2005 to create accreditation program for healthcare organizations, and it is a constituent board of QCI, that is Quality Council of India. We'll see in the next slide what is QCI. In 2006, They set first edition of standards, and in 2007 they accredited first hospital in Kerala, and up to now they have done it for 8,000 plus healthcare organizations. It itself is accredited by ESQA, and their standards are focused mainly on patient safety and quality of delivery of services. So what is QCI? QCI, it is an autonomous body, self-sustaining, non-profit organization registered under Society Act and has its own MOA and rule. These are the 5 constituent board members, which are NABCB, that is National Accreditation Board for Certification Bodies, National Accreditation Board for Education and Training, that is NABED, NBQP, that is National Board for Quality Promotions, NABH and NABL, which is responsible for accrediting hospitals and laboratories. These are the 5 constituents of Board of Quality Council of India. NABH has set up standards for all kind of healthcare organizations like hospitals, diagnostic centers, Ayurvedic centers, dental centers, even clinics also. Since we are going to discuss about the hospitals and diagnostic centers, that is medical imaging services, also called as MIS, so let's stick to these 2 only. Recently they have issued the 5th edition of their standards in April 2020, and this is the first time their core objective is patient safety. In December 2019 they issued 2nd edition of standards for medical imaging services. Earlier NABH accreditation is used to be of 3 years, but in a recent letter of May 10, 2020, they have revised the period of accreditation cycle, that is for 4 years. So whichever hospital will undergo accreditation now, they will be accredited for 4 years. This is the process of accreditation, where application is submitted, fees is paid, then there is a pre-assessment, and whatever non-compliances or non-conformities are there, they are diluted first, and once it is done, organization goes for final assessment. So whatever non-conformities are there, that needs to be sorted out, and then once they are sorted out, hospital is accredited for NABH. At the period of 20 to 24 weeks, this is the old record where they were showing 15 to 17 months, but now it is 20 to 24 months. Surveillance assessment takes place, and before 6 months of expiry of accreditation, reassessment takes place. So NABH has 651 objective element standards. Out of that, 102 are from core category, and they are assessed every time in each assessment, which needs to be followed before going for accreditations. So those 102 standards has to be there before going for standards. There are 459 standards which comes under commitment category. There are 16 achievement category and 13 excellence category. This 459 is seen during final assessment. In surveillance assessment, these 60 standards are seen, and during re-accreditations, these 30 standards are seen. So the NABH standard for hospitals book has 10 chapters, which includes access, assessment and continuity of care. In second, care of patients. Then management of medications, patients' rights and education, hospital infection control. In 6th chapter they say patient safety and quality improvement. Then responsibilities of management, facility management and safety. In the 9th, human resources management, and in the last chapter they say about information management system. But for diagnostic centers, they have divided their standards in 7 chapters, because many of the things which are there, which are applicable in the hospitals, are not applicable in the standalone diagnostic centers. And mostly they are all from which are there in the standards of hospitals, like access assessment and patient care, imaging procedures and interpretations, facility management and safety, human resources, information management, system management of quality and safety. These are all the chapters. Mostly they were there in the standards of hospitals. These standards are available in public, and if you search for NABH standards 5th edition, you can easily find it. This is how we can search and we can get standards. So this is the book of 5th editions of standards for hospitals. These all are 10 chapters which are there in their book, and in each chapter they explain what is their need. There is a summary of standards and objectives, and they say clearly what is commitment, what is core, and this color code is also given, like core, commitment, achievement and excellence. So what they need in each category, they clearly explain that on each category which standard is required. And at the last they have shown as a references also, which was not there in earlier part of books. So whatever we wanted to refer from those references, that we can see. Just a brief summary. I'm not going to read out all this. This you can download it from internet and see what are their summary of standards. So just few look on that. The organization defines and displays the healthcare organizations that it provides. Means the organization should display what they are going to provide this as a service. The organization has a well-defined registration and admission process. There is an appropriate mechanism for transfer or a referral of patients. Means everything is laid down properly. In chapter 2, they say about care of patients, where they ask for uniform care of patients. Emergency services is provided in accordance with written guidance, applicable laws and rules. Likewise, they have written all those standards in chapter 2. In chapter 3, the pharmacy services and uses of medications is done safely. Means everything they have tried to summarize in all these chapters. Please download the document and go through. In the next part, we are going to see, based on those standards set by accrediting bodies, what actually do we need to have as a structural requirement, as a procedural requirement, and as outcome related needs. Like even taking a feedback from patients, even taking the feedback from referring physicians, that is also very important. A feedback from staff is also very important. So the outcome related needs, everything is defined, and they are all needed in this standards. So that we are going to see in the part 3. Please feel free to write us at support@nuclearmedicinesolutions.in for any feedback or query. Thank you very much.